Good morning, Val.
Oh, good morning, sir. Please sit down.
Yeah.
Okay, before we start, let me introduce myself. My name is Dr. Deva. I'm the doctor that's responsible for clinical risk for today. And to what pleasure do I owe you in your with your visit?
Yeah, so it's not quite pleasant. It's I've been experiencing lethargy. I don't know, but these past month I've been really tired.
Hmm.
Yeah.
What's your name? I forgot to ask. I'm sorry.
I'm Deuce.
Okay, Mr. Duke.
Yeah.
How old are you?
I'm 25 this year.
You're 25 this year. Okay, so do you work already or are you still in college?
I did some work like
Hmm.
for the past 5 months.
Past 5 months.
Yeah, but that's about it.
So you're not like a freelancer?
Yeah, you can say that.
Okay, to get back on track, you said that you've been feeling tired, right?
Yeah.
Since when?
For about 1 month ago.
1 month.
Yeah.
Okay. Do you have any other complaints than being tired? Maybe shortness of breath, or you feel dizzy sometimes?
I do feel some shortness of breath, but it's only when I'm working.
Okay, so do these symptoms happen at once?
Yeah, I'd say.
Do you in any way, is there like some things that make these worse, or something that make them better?
So it's basically either when I'm working or when I'm studying for my exams or when I was working out.
So either physical activity
Yeah,
or high
something.
stress.
Yeah.
Okay. What about your in the past? Have you ever had anything like this?
No.
Since you said it only happened since 1 month ago. Right?
Yeah, I've never experienced anything like this. Neither does my friends or family. They don't know what's happening with me.
How about you know, your bowels? Have you had any recent changes in your maybe when you poop?
No.
None.
I do have had a long history with celiac disease.
Oh, celiac disease.
Yeah.
Okay. How about your family? Maybe your parents, your siblings?
No,
Things like that?
they don't have this.
So none of your family members have celiac disease.
Yeah, fortunately, none of those.
Have you ever used any medications? Maybe you had GERD or bowel problems with your stomach acid.
I did, yeah. I took
Okay.
what was it? Omeprazole.
Omeprazole.
Yeah.
Can I take a look at your things? Since
Sure.
I've been suspecting something, since you do look kind of pale. Are your nails brittle?
Oh yeah, they tend to, break off.
Break off.
Yeah.
They break off easily. Okay. This is going to be a little bit, uncomfortable question, but we kind of need it for this exam. So, what about your economic status?
Oh, I'm fine.
You're doing fine.
Yeah.
Okay. How about your diet?
My diet. Yeah, so I've been trying this new diet recently. Well, you've been going on for 6 months.
6 months. Okay.
Yeah, so I do this thing, they call it, what do they call it again? OMAD, 1 meal a day.
OMAD.
Yeah.
So you only eat 1 meal a day.
Yeah.
I do
Ideally, that's a lot.
Oh, so you eat
Like 2,000 calories.
2,000.
Yeah.
You do track your calories too.
Yeah.
Okay, so do you eat what kind of protein do you eat usually?
Cheapest protein would be tofu, but I eat quite a varied foods.
Do you eat meat?
I eat fish. I eat a lot of fish and tofu.
So you're pescatarian, or do you still eat meat?
I just really like fish.
Oh, okay. From our session here, I think I already have my diagnosis, or what I suspect of you right now, because we're gonna have to run some few tests to actually confirm. I think you have you're suffering from anemia. It's mostly from iron deficiency anemia because your parents, you said your family did not have, you know, anything that did not experience anything that you have, right?
Yeah.
Yeah. Um, from I would like to tell you that this anemia that you have, I think it's from lack of red meats. It's be- or more specifically iron, because red meats have an abundance of iron, and you've been eating like a lot of fish instead, right?
I eat like a lot of white fish.
Yeah. Do you drink tea?
I do.
How often?
After every meal.
After every meal.
Yeah.
Okay, so that's another factor. So tea has like these chemicals called tannins that if you drink right, especially right after your meals, it's going to disrupt the ability of your body to absorb iron.
Yeah.
And seeing that you have reduced amount of iron intake because you don't eat red meats, right? That's like less iron and less absorption. So that's definitely a great case for causing anemia in your skin. The symptoms of lightheadedness or dizziness and pallor, like your pale skin, and also your tiredness, it's all from anemia and lack of iron. So what I want you to do is you're not uncomfortable. You're not trying to avoid red meats in any way, right?
No, I'm not. I'm just not the biggest fan.
Yeah, you have. So you have to actually increase your red meat intake because they do have iron. But if you don't,
But tuna work?
oh yes, tuna works because it's also red meat. That's a great alternative.
I see. That's great.
Also, if it's vegetables, spinach have a lot of iron. And I would like you to reduce the amount of tea that you drink. And if you still want to drink tea, then, yeah, of course. Then if you still want to drink tea, then you can space it out so that it doesn't disrupt the iron directly. And you can also drink vitamin C, as they help the absorption of iron. So I would prescribe you with that for now.
Okay.
Just those tablets, like once you put in your drink, and then that you like those, right?
Yeah, of course.
And
sour
for now, I would also prescribe you with 1 week supply of iron tablets, maybe just 21. I think you should cut the OMAD for now.
Oh.
Because you can only absorb so much iron in one sitting,
That's
like a limit per digestion. So I think you should eat 3 times a day for now.
Okay.
Yeah. So take these iron pills. So I have 21 pills. So you take them once right after your meals to help with the iron absorption. So you're gonna have like 3 per day times 7. That's 21 pills. Right? I'll give you those. Yeah, I think that's about it for now. Check up with me after 1 week to see your progress and to see if we need to do any further testing if you still have any problem. But if you don't, then it's hard to not come back here.
Okay.
Okay. That's about it. Any other questions?
No, that's pretty clear.
Okay, so be sure to update me. Keep me up to date, and we'll see your progress in 1 week. Thank you, sir.
Yeah, thank you.
Okay, good morning.
Morning, doc.
Yeah. Pleased to meet you. My name is Dr. Deva. I'm the one who's responsible for the this clinic.
I'm Deva.
Okay, Deva, may I know how old you are?
I'm 21.
21. Okay, so why did you come here today? Like, what is your main complaint?
Yeah, so I've been feeling very tired for the past month. I don't exactly know why, and yeah, my skin's been turning quite yellow.
Quite early.
Yeah,
I can see
since 1 week ago.
So,
It keeps getting yellow.
since when have you been tired?
1 month ago.
1 month. And the yellowness is 1 week.
Yeah.
Right. Okay, so like, do you have any other complaints other than being tired? Maybe you feel dizzy, or there's like breathlessness.
Only thing the thing I feel is shortness of breath.
Shortness of breath.
Yeah.
No palpitations or something
No.
like that. So, yeah, shortness of breath. When was it? Since when?
Since 1 week ago as well.
1 week ago. Okay. Um, how do these like affect your quality of life, your job? Do you have a job,
Yeah.
or are you in college?
So I'm in college right now, but I also do some day trading, but that's about it.
These are day trading. Do you feel any disturbance? These like symptoms cause you?
Well,
Do they burden you in any way?
of course, my routine's I'm not as enthusiastic as before. Definitely affected my performance.
Okay. How about anything like, do you have any diabetes?
Oh no, I don't have any serious chronic.
Any bone pain? Like bone pain?
No,
Or
no bone pains.
none of those. How about gallstones?
No, thankfully not.
Any hearing or vision problems?
No,
None. Okay.
none of those as well.
Do you have any problems with your, digestive system?
No, not so far actually.
How about other chronic diseases?
No, I don't have any.
None.
No.
Have you ever done a blood transfusion? Ever taken blood transfusion?
Actually not.
No.
No, never. I've donated blood, but that's about it.
Okay. So you were cleared for donating blood.
Well, it was quite a while back.
Mm-hmm. How really? Few years.
Yeah, spent a few years.
Yeah. Because it does seem like you're quite fit.
Yeah,
Yeah.
I see that as well.
Do you have any allergies?
No, not discovered.
No medication allergies.
No.
None. Okay. How about your family? Do you have any relatives with anemia or something like that?
Thankfully, my family's been free from these conditions, but
So they also don't have any other.
I do have a distant relative that has
anemia, or is it something else?
some kind of
anemia.
yeah, some kind of blood condition.
Oh,
They have to get blood transfusions every so often.
that's curious. That's curious. So I think I do suspect. I do know what I suspect from you, from what I've seen. The yellow skin and your symptoms. So, since your family don't have that, your distant relatives have it. Yeah, they do sometimes have yellow skin. If you have
I'm not sure.
How about tiredness?
I don't meet him often. I don't need. It's only word of mouth.
Well, yeah. So, what I'm guessing is that you have thalassemia.
Is that a serious condition?
It's. I would like to say that it is quite a little bit serious, because it's basically just a meaner older brother or older sibling of anemia, basically. So this disease is genetic. It could be passed down maybe from like your old relatives, or maybe some of your maybe your parents have the gene for it. Yeah, so it could be inherited from them. And to treat this, you may need some blood transfusions, because this disease basically is like a breakdown of blood. So that's why
Do I have to do this for the rest of my life?
um, we will see, because it's not like it's guaranteed whether it'll be lifelong, like lifelong or not. We'll see if you can, alleviate the symptoms and go into remission. But keep in mind that this disease is genetic, and it will, even if it seems like it's gone, it can relapse.
Oh, I see.
Especially, but we can take care of the yellowing, I think, with transfusion. And we're also gonna give you iron chelators, because there's also an overload of iron, because of the breakdown of the blood. And we're also going to give you folic acid. Uh, do keep in mind that there are side effects and risks involved. Blood transfusions can you can get infections if you're not careful. But I can guarantee that our equipment is well treated and sterilized, and uh, and overload of the iron can damage organs. So we will need to monitor that regularly. And yeah, so the prognosis for the disease is generally good as long as you keep adherence to your treatment and medications that we give you. And uh, yeah, that's basically it. You so we're gonna do some transmissions. Some blood transfusions for you. It's gonna be a quiet routine.
Okay.
Are you fine with that?
Yeah.